Welcome to Medicine Handy Point. Today we will discuss fever and we will discuss history taking in a patient with fever. So this is a very important and comprehensive topic which has covered a lot of questions regarding the fever history. So let's start. Fever is when the core body temperature is above the normal. So what's the core body temperature? Usually oral temperature, it is between 97.6 to 99.6 with an average of 98.6. But there is a diurnal variation, like in the morning. Usually if we check temperature at 6 a.m., it will be less, like around 97.6, and if we check it in the evening at 4 p.m., it will be raised like around 99.6. So that's a diurnal variation. The maximum oral temperature in the morning can be 98.9, while the maximum oral temperature in the evening can be 99.9. So any temperature above 99.9 will be considered as a fever. So mild fever or temperature is 100.4 to 102.2. A moderate temperature fever is 102.2 to 104, while severe fever is or high grade fever is 104.1 to 106. So that's how we classify fever into mild, moderate, and severe, or mild, moderate, and high grade. So now let's move to the next slide. So when it's come to the fever taking history, the first question is, we ask the patient, does the patient has really checked his or her temperature with the thermometer? If the patient say yes, then we start with the history. Ask the onset and duration. So we'll ask the patient whether the fever started all of suddenly or there was gradual onset of it, and for how many days the fever is present. So then the next question is to ask about the fever characteristic. So this includes, like, if the patient is having continuous fever, intermittent fever. Intermittent fever is divided into quotidian fever, which is daily fever spike, tertian fever, which is every 48 hours, quartan fever, which is every 72 hours. Then remittent fever and relapsing fever. Relapsing fever is fever occurring every 3 to 5 days with a period of no fever in between. We will ask about Paul Epstein fever, which occurs in lymphomas. There is a cycle of fever for 7 to 14 days, then no fever for the same duration of time. So we'll ask about these things, whether the patient has having continuous fever, remittent fever, intermittent fever. In intermittent fever, then there is quotidian fever, tertian fever, and quartan fever. Then there is remittent fever and relapsing fever. Relapsing usually occur in brucellosis. Paul Epstein fever pattern occur usually in lymphoma. Then with that we ask associated symptom with fever, which if the patient is having chills and shivering, it means the temperature is rising. That's why the patient is having chills and shivering. And if there is a sweating with it, means the patient has in between fever lysis, means the fever is intermittent. So when it goes away, the patient has sweating. So now, then we will ask nausea, vomiting, and anorexia with fever. We will ask about weight loss with the fever. So these will be the associated symptoms. Then we will now find out the etiology of the fever. So the next question is that we will ask about, is there any mosquito in the vicinity, and if are present, is there any preventive measures to prevent mosquito bites? Because if there are a lot of mosquito in vicinity and no preventive measure, so malaria, dengue. These can be transmitted by mosquitoes. Then we will now focus on etiology. So we'll start with respiratory system. In respiratory system, we'll start with ENT problem and then move on to the chest. So for flu and cold, we will ask if the patient is having any sneezing, running nose, or blockage. For sinusitis, we will ask about facial pain, headache which gets worse on bending fall. So this is sinusitis. For pharyngitis, we will ask pain in the pharynx or difficulty pain on swallowing. We for otitis externa and media will ask pain in the ear in discharge from the ear. For gingivitis and dental abscess, we will ask about pain and swelling in the gums. Then we will ask about for pneumonia, which is a chest problem. Now we will ask about cough, sputum, hemoptysis, pleuritic chest pain. So this that will cover our respiratory problem. Then we will move on to gastrointestinal conditions. So we'll ask if the patient is having fever with diarrhea. If yes, we will ask about any blood in it. If it's present there, then dysentery is one of the differential. If we will ask about if patient is having fever with constipation, so in typhoid it can occur. We'll ask about fever with jaundice and pain in abdomen, mostly in right upper quadrant, which could be acute hepatitis, acute cholangitis, acute cholecystitis. They can present with fever in right upper quadrant vein, sometimes with the jaundice as well. So we'll ask about that as well. Then we'll ask about fear with any abdominal distension and fluid in abdomen, which could be TB or spontaneous bacterial peritonitis in case of cirrhotic patient. We'll ask about drinking any unpasteurized milk, which can cause TB intestine. So this will mostly cover the condition causing fever related to gastrointestinal tract. Then we will ask about genitourinary conditions, like we will ask any increase in frequency of urination, but hematuria, blood, or any burning sensation, or in pus discharge from the urethra. We will ask about flank pain. So all these conditions will help us finding out the cause for the fever related genitourinary condition. We'll ask about vaginal discharge and back pain, pointing towards PID. So the PID present with those symptoms. Then we will ask about CNS conditions. So fever with headache and neck stiffness could be meningitis. Fever with focal neurological deficit, seizure, or confusion could be encephalitis or cerebral abscess. Cardiac condition which can cause fever, these include pericarditis. So fever with chest pain worse on lying down could be pericarditis. Infective endocarditis can present with fever, chest pain, palpitation. Acute rheumatic fever can present with fever, chest pain, and joint pain. While we will also ask about any history of ASD, VSD, or valvular lesions. Then we will ask about autoimmune conditions. So what are the autoimmune condition which can lead to fever? So these are SLE. So the brief questions are fever with photosensitivity, rash, and oral ulcers. Rheumatoid arthritis will ask about fever with joint pain and swelling. For Sjogren syndrome, we'll ask about fever with dry mouth and eyes. For Ehlers disease, we'll ask about fever with joint pain and any lymph node enlargement in the neck or liver spleen enlargement. For vasculitic lesions like Wegener granulomatosis and polyarthritis nodosa, we'll ask about any skin rash, epistaxis, hemoptysis. That will give us some clue about the vasculitic cause for the fever. Then for the malignancy, we will ask fever with weight loss, night sweat, pruritus, anemia, lymph node enlargement, or hepatosplenomegaly, which can point to lymphoma, leukemia, respectively. Other malignancy can also present as a fever. So we'll ask accordingly. Then other question we can ask is, we will ask about any animal or birds exposure. We'll ask about exposure to TB patient in recent travel, which will help us in finding out causes for the fever. I hope you will like the video. It was a very comprehensive discussion regarding the history taking of the fever, and please subscribe to the channel.